Sharleen Stewart, what is going to be the effect of the meltdown on healthcare workers in Ontario?
Well, with the anticipated announcement of huge deficit in the hospitals coming in March in the Liberals' provincial budget, they've already warned or put the flags up that there could be layoffs in our members' services, and that is the support services inside the hospitals. And that is everything but the registered nurses. So that's all the support services, clerical, housekeeping, paramedicals, RPNs.
How many workers are we talking about across the province?
Across the province in our hospital sector is close to 20,000.
What happens when you start? What happens to Ontario's hospitals? When we start losing those kind of people from those professions?
Well, unfortunately, whenever there's a deficit, people look at the bottom, the grassroots, the real providers, to start laying off staff resources is what they look at, instead of going to the top and taking a look at how top-heavy management is. So, if they lay off our members, then it's going to have a huge impact on the delivery of healthcare services in this province, which is already in crisis.
How is the economic crisis being used in bargaining with your members?
In some of our sectors, the employers are coming in and claiming financial hardship in 2009, but they are dealing with contracts that expired in 2007, 2008, where the economic crisis wasn't as relevant as it is now. So they're using this as an excuse. They're using their poor management from 2007, 2008, and hiding it with the economic crisis of 2009. So we're looking at the time when these members should have gotten an increase in those years and what the economy was like then, and pushing that back on them, that we want to deal with it in the times that were the contract dates.
I understand that a crisis is brewing in the field of home care. Cathy Carroll, what is it that's going to occur next?
Well, we've been trying to bargain with Red Cross in home care. A big issue in our home care sector is the issue of travel time, where workers aren't paid for travel between their clients. Combined with the low wage they get, when you take it over their entire workday, it puts them under the poverty line when it comes to the amount of money they're making on a yearly basis. We've been lobbying the government to put some money into this, put the funding into the travel time so that they can attract more people into that sector. And giving the economic times, there's jobs within that sector. It's a growing industry, and the government should be looking at how do we improve the working conditions of people in that sector, so that when we start training people who've lost their jobs and put them into a sector that's growing in healthcare, that they'll be able to go in there at a decent wage and with decent compensation for doing the job. People are not going to be attracted to that sector where there's going to be an influx of jobs until this government puts the funding there to make the job worthwhile to go out and do. The government's continuously saying that the government spends way too much money on healthcare dollars. There's deficits in hospitals. They're looking at strategies for wait times, strategies to take care of long lists for nursing home beds. And they keep saying home care. Home care is the answer. And we believe home care is the answer. But until you have a stable, well-compensated workforce to deliver home care, you're not going to have the resources you need to move forward with that kind of an agenda with healthcare dollars.
So in a very real way, health care, home care are economic stimulus issues as well. Have either of you looked at, has your union done research on the impact in terms of economic stimulus of investment in health care?
The investment in healthcare? Oh, healthcare has become a commodity for a lot of for-profit corporations. Home care is an example of it. It's an exploding industry, and if it was managed right and brought into the public system, it could be a very successful answer to, yes, you're right, an economic stimulus. It could be, because there could be jobs there, as well as it could be something that the government could control under their own their own envelope, rather than worrying about the profiteers coming in, worrying about dollars rather than a service being delivered. So it's all about profit in a lot of it. Nursing homes is the same way. Retirement homes is the same way. So they're trying to download, as Cathy said, from the facilities like hospitals into the home where a lot of the residents want to be, or a retirement home where they can have assisted living, but you need people to take care of it and you need proper management. And as long as there's always that profit line in anybody's intention that manages this service, then you're going to see the results, bad results, in the delivery of service.
And that profit line is what got us into the mess that we're in now, isn't it?
The profit line, absolutely. People put profits before the people that they were serving and before the people who were delivering and making the profits